Welcome to Your Anxiety Toolkit. I'm your host, Kimberly Quinlan. This podcast is fueled by three main goals. The first goal is to provide you with some extra tools to help you manage your anxiety. Second goal, to inspire you. Anxiety doesn't get to decide how you live your life. And number three, and I leave the best for last, is to provide you with one big, fat virtual hug. Because experiencing anxiety ain't easy. If that sounds good to you, let's go. Welcome back, everybody. I am so thrilled to have you here with me as we close out 2022 on a high. We have 3 incredible episodes finishing us up for the year. This week's episode was a beautiful conversation I had with Krista Reed. Krista Reed is an OCD specialist, an anxiety specialist. She's also an advocate for the International OCD Foundation, which is where I met her. And we got talking about the importance of including family members in OCD treatment or anxiety treatment in general. So we jumped on and recorded an interview where we talked all about bringing in the family to be an effective catalyst for the person who is suffering with anxiety. We talked about how to not overuse them so everybody has a place and a purpose and are valued as a part of this great big team to sort of help the person with OCD and also to support those who are witnessing someone who has OCD. It was such a beautiful, beautiful conversation. And there were multiple times where I actually stopped to write notes and really thought about how my team, because we have a team of amazing OCD therapists, really stopped to think about how could we be better at, number one, supporting the family members of those who are struggling, but also using the family members so that we have this robust support team backing the person who is struggling. So this was really, really helpful for me as a clinician. I took away a lot of ideas and notes. And I'm just so grateful to have the opportunity to talk with Krista. Before we get into the episode, let's do the I did a hard thing. And this one is from Ryan. Ryan says, part of my OCD is health anxiety and health obsessions. I was due for a yearly physical this week and I was in a full-blown anxiety mode, racing heart, shallow breaths, chest pain. I think we all totally resonate with that, Ryan. I let myself experience the discomfort and called the doctor and made the appointment. I hung up the phone and immediately broke down in tears, not for sadness or fear, but how proud I was of myself for doing the hard thing. Thank you for your podcast. Ryan, this is so cool. And I think we've all been there, right? And it's such a hard thing to make that call. I know that dread, for me, it's the dentist, that dread you feel, that anxiety you feel, that panic you feel. So Ryan, you're doing the hard thing. Thank you so much for sharing that with us. We celebrate you. Let's get over to the episode with Krista. Well, welcome, Krista Reed. I am so excited to, number one, connect with you, but to talk about a topic that I don't talk a lot about, which is something that I'm excited to really talk about with you today. So welcome.
Yes, thank you so much for having me. I'm excited.
Yeah, look at you. For people who don't see you, you're everything's bright and it's so happy. It makes me so joyful just to see you.
Thank you. Anybody that has met me will get it. I'm a very colorful person.
I love that. We need more of you in the world, I really feel.
We need more of you.
Good thing I made children that sort of created more of me, right? That's the best I can do.
There you go.
All right, let's talk about supportive siblings. Let's talk about how the family can play a role in recovery. I kind of want you to take the lead here and tell me everything you know. So tell me a little bit about why this subject is important to you and how you've used it in clinical and in the field of OCD.
Yeah, absolutely. And so I'll give you just a little bit of background. I always have been interested in sibling dynamics. And in fact, when I was in grad school completing my thesis, I even consulted the director of the program. I said, are there any theories about siblings? And he's like, well, there's the one by Alfred Adler on birth order, but really outside of that, no. And that has just always been so entirely profound, because when we think about family work, if you're looking at family theories, if you're looking at different types of family interventions and models, a lot of them really focus on parent-child. And when you're dealing specifically with a child who has, and I'll go into the physical medical side as well, because I don't think this is exclusively just OCD or just mental illness. When we're seeing that, a lot of times the model is fixated on the child with the medical issue and the parent. And what I was finding was that siblings, they kind of get othered in this whole process. And the definition of othered is essentially, being excluded from meetings, being excluded from family sessions, being excluded in some way, shape, or form. Now, I could see how potential listeners will say, well, isn't it the child with the OCD or the child with the medical issues othered? Yes, I'm not debating that at all. I'm saying primarily within the family unit that the sibling themselves can get very othered. And siblings struggle when their sibling has a disorder. They can struggle emotionally, they can struggle behaviorally. Just looking at the construct of OCD, they could struggle with the grief of their sibling having OCD, the moods that may come with the disorder. And oftentimes this can lead to resentment within the sibling relationship, or even guilt or shame. And I have siblings, and I think this potentially might be even where a lot of my work is very important, because I am very close to my siblings. I am super close. Like I feel like I'm very fortunate. I have amazing relationships with my siblings. And so it absolutely breaks my heart when you see a child who has this some type of distance within their sibling relationship, either because they themselves have the disorder or their sibling has the disorder. And so I started finding different ways to incorporate siblings into the therapeutic model. I'm really big into family work. I don't understand how, especially when you're working pediatrics, and that's primarily what I'm going to focus on today, is a pediatric work. I don't understand how, when you're working with pediatrics, how you can't have the family involved. To me, that doesn't make any sense, because we're seeing, especially in the outpatient world, we're seeing these kids an hour a week. So tops 4 hours a month. Pretty sure they're with their families a lot more than just 4 hours a month. And then thinking about the siblings. What can we do to make them feel like they're not being othered? How can they also not be parentified? Because that sometimes happens within the disorder world, is the siblings may feel that they have to have some type of responsibility for their siblings' medical issues. And that is absolutely, I don't want any sibling to have that. I want them to have a childhood. I want them to be kids. But how can we incorporate them without parentifying them and without othering them, and also bringing in the family as a whole and tackling this beast together, whether that's OCD or whatever that beast might be?
That's so interesting, because as someone who treats OCD but also treats eating disorders, I have found that, you'll treat the one child who has the primary disorder. We get them better. And then a year or two later, the other kid that didn't have the diagnosis starts to suffer, and all this emotion comes out, and they start to really acknowledge how painful it was for them. And it all comes out later. But I know that there are other cases where it comes out during, and you've got multiple things happening at once. So that is why I think this is so important, is in my early days of treating, you would be like, no, the sibling's fine. Look how well they're doing. They're doing well in school, and it's quite a miracle, isn't it? But then, it all comes out, right? It all comes out. So I love that you're talking about this, right? And number one, before we move on, is this true of not just siblings? Would we say this is true of partners of OCD, or
eating disorders or depression as well? Like, does this spread to that, or what are your thoughts?
I agree 100%. You know, this, I hate to call it curriculum because that makes it sound so sterile. Process, I guess I'll call it. I feel that this process is, and as you know, aforementioned, it's not just about OCD. I can see this being across the board for any medical issue. Absolutely. It could be for a roommate. Let's not even let's take out the family part. You know, working with a college student who has a roommate that maybe they're pretty close with. Absolutely. If they're willing to bring that person in, how can we incorporate them? Because doesn't that client win?
Yeah.
That's what we're wanting, because we know that no matter what your medical diagnosis might be, relationships struggle. And that is the absolute last thing I would wish upon anybody.
Yeah. I'm even thinking of me as someone with a chronic illness, on how I think it even, like you said, it stretches to medical too. Like that, you know, I look back, tell a quick story. I look back to when I was really sick. And I even remember seeing my children starting to play a parental role on me. Like, what do you need today, mom? And stuff like, no, I'm supposed to be asking you that, hun. Like, I think that it can spread. So I think that that's again why I think this is so important. So I'm going to skip to my main sort of questions here now. Is like, you talk about what is called a coach, like an OCD coach. I know I've watched one of your presentations. Like, do you want to share with us what this model may look like?
Yeah, absolutely. So before I even talk about the OCD coach, because that's not like, I'm not reinventing the wheel. This isn't something that I think a lot of your listeners are going to say, oh, like that's a new thing. No, it's not a new thing, especially when working pediatrics. That's a pretty common term, because that's what we really want these parents or caretakers to be of these kids, is we want them to be able to learn how to do what we are doing with their kids, so they don't have to be in therapy forever. So I developed this process and I call it Be Seen. Seen is an acronym because why not? As medical professionals, we love our acronyms. So let's make another acronym. And also it's really easy to remember.
Right.
And I chose this specific acronym. One, it fits the letters really nicely of what I was hoping to explain throughout this process, but also for a couple different reasons. One, I have OCD and I struggled as a child and adolescent. And one of the primary factors in my own recovery that was so profound was I realized I did not want to be seen. I did not want people to know, because I felt bad. You know, that shame just smothers you like a blanket. And it was embarrassing. And then I was thinking about it from the other side of siblings. When you have a child who has a chronic illness, you think about how often are they going into doctor's appointments? How often are they going into whatever type of treatment facility they may be utilizing? The sibling is often, they can get hidden. And in fact, I think it was Chris Bear who did Unstuck who actually called the sibling the forgotten child. And
such a Chris fan.
I absolutely. I'm gonna get to how that whole thing actually kind of birthed this idea here in a bit. But thinking about just how profound it could be for this sibling to be seen. And as I mentioned before, I don't want them to be responsible for their siblings' treatment. That is so incredibly inappropriate. And I want them to have a childhood. But I also want them to participate and have a relationship with their sibling. So when I think of an OCD coach, essentially how I define an OCD coach is going to be, that's going to be the adult figure. So that is going to be the person that is going to take the child to therapy, to treatments. That's going to be the main one utilizing exposure and response prevention therapy. They're going to be kind of the one overhead. And I like using the word coach because one, I really like sports. And I just think that there's something kind of neat about a coach, because a coach is going to be, they're going to be tough. They're going to be fair. And at the end of the day, all they want is for you to win.
Mm-hmm.
I just think that's such a cool concept. And when you tell that to a parent a lot of times can say, okay, so I get that, because I could say, I want you to be the parent to the kid, but also think about a coach. Because when you have your child on a team, that coach is going to be tough. And I'm not trying to take the emotions out at all, because we know coaches can be incredibly empathetic, but coaches are probably going to push your child a little bit more than you would push your own child. And so putting yourself into that role and thinking about, this is for a win. I know my child might be hurting. I know my child, because they're doing the exposures, because you're not allowing them to have the OCD accommodated. You're pushing them to grow. So putting yourself into the coach's role versus only solely the parent's role can be such a powerful metaphor for parents. And I just really, really love that. Mm-hmm. So when I'm looking at the siblings, I call those the assistant coaches. Those are the ones that can assist and help out the players. So the child that is in therapy or in treatment or whatever necessarily it might be. And so be seen. So each letter of seen represents something. S is supportive. How can you support the child? And I've actually created worksheets that are age appropriate for the sibling and the child with OCD, which again, it really could be any kind of medical thing, because the acronym really doesn't exclusively cover OCD. They can do this together. And so S is supportive, finding different ways to support. And with the worksheets that I've developed with ages 5 to 10, I just love this. It's an art activity, and the kids together get to draw them slaying, I'm using quotation marks, slaying the OCD monster, or making a can of like OCD away spray. Mm-hmm. And so it's just a really, really cute activity to do. And again, because it's ages 5 to 10, that's such a level of mastery and explorative. And, you know, they like to draw and color and play at that time. So even if their sibling with OCD is a lot older, think about what an amazing bonding experience that could be. If you have a 5-year-old sibling and a 12-year-old with OCD, that's a pretty cool situation to be able to put those two together to talk about it. Because then that 5-year-old, I mean, how empowering and beautiful that is. It's like, okay, so, you know, older sibling, I'm going to draw a can of away spray, and this is what it's going to do. And it's going to help get rid of this and this. And we know that children think so highly of metaphors that could be such a really cool way for them to interpret that and to be able to understand that, because we also don't want little kids to, well, it's not we don't want to, it's they just simply don't have the cognitive abilities to understand OCD comprehensively.
Yeah.
So let's find age appropriate manners to be able to do that. And then the next one is empathy. I'm not going to lie, doing an empathy exercise with kids can be a little bit challenging. And I think that because the emotions are so complex and situations are so complex. And so I was trying to find a way to be able to put this in a manner that a 5-year-old is going to comprehend, and yet also like a 15-year-old is not going to think is too babyish.
Yeah.
Per se. So it's another worksheet, because these are all worksheets. It's another worksheet where the siblings can work alongside each other, and it really can go either way. It usually works better if the child with OCD goes first. And so the child with OCD can share a feeling. So for instance, I feel disgusted when I'm around a bad food. I'm just going to say something super blanketed. And then the sibling who does not have OCD could say, okay, so let's talk about disgust. When do you feel disgusted? And they might say, I feel disgusted when my parents make me eat broccoli. And so that's just a really cool and simple way for them to see that this is, you know, we can relate on emotions. And we don't have to agree on your emotional reaction, but we can realize that we all have these emotions and this is how we can bond. And so for a young child, this could also be a really cool lesson in emotional intelligence, because they may not necessarily understand or comprehend all of these different kinds of emotions. I'm not going to lie, I think this might be my favorite one, because I think this really encompasses a lot of different things. I love empathy exercises. I'm sure you can relate being.
Well, I think it builds on that common humanity, doesn't it?
It really does. And that's the whole point is, going back to what I mentioned about being seen, we're all humans and we're flawed. And we don't want anybody to feel like they have to be perfect in this process. And we don't want anybody to feel like they have to be all knowing, because there's such a beautiful way too, which is actually, I was going to go back to supportive. I already talked about supportive, but it's a really cool way to support each other and also not feel like you have to be an expert or treating them per se.
Yeah.
All right. So then the next E is encourage. This one in the worksheets is make a sign. So like if you were because again, these are assistant coaches, and I'm kind of using the metaphor of sports or games, or like if you're running along a marathon, what sign would you hold for your sibling? And so then they get to make a sign. For older kids, it could be Post-it notes. Have Post-it notes and then put it like in your sibling's lunch or on the bathroom mirror. Draw a picture for them, make a card for them, finding different ways to encourage your sibling without feeding into the OCD. That could be a really big part of it. Because let's say, for instance, you have a sibling who their OCD attaches onto the color black. Black is death. Black is well, you know what? We're just not going to draw with the color black, because it's not the sibling's responsibility to do the exposures unless that is something that has been discussed actually in the therapy session. Because again, I can't say it enough that I do not want the sibling to ever be in charge of treatment or exposures or anything along the lines of that, of course, without actually working with a therapist beforehand.
Right. Can I ask you a question really quick, just to clarify terms? So the parent is the coach.
Yes.
Right?
Yes.
And then the child is the assistant coach you mentioned.
Correct.
Do they get assigned that, or do we just call them that? Do they know they're the coach? Do we use those words? Do we assign them that? What are your thoughts?
I think that could really be up to a parent. Those are just terms that I've used.
They're like conceptualizations.
Exactly.
Okay.
Because children work so highly with metaphors and they can use whatever. I had a child once say, well, I don't want to be a coach. I want to be a cheerleader. Cool.
Mm-hmm.
And you can be the cheerleader. Okay. Be really kind of whatever.
Right.
It's like if they want to be the water boy. I mean, I don't care. As long as whatever they can conceptualize it as, and we can still kind of follow this supportive method.
Okay. Thank you. I just wanted to clarify that. So, okay.
Yep.
We're up to N.
That's just great. I say N is non-judgmental. And this is the part that we really, really, really like to push, that OCD is not your sibling's fault. Absolutely not. The sibling did not ask to have OCD. They're not doing this on purpose to despise you or for whatever reason. And also realizing that as the sibling, the way the sibling with OCD behaves is not the sibling's fault. Mm-hmm. This can be a part where you have some psychoeducation and learning more about what OCD is and what OCD is not, and finding different ways to be able to talk about that. Because that itself can be very difficult. And I do a lot of psychoeducation when I work with families. And this is where I was going to bring Unstuck back. I think that even before going through this process with families, Unstuck, in my opinion, I'm sure other professionals, have their own ways of doing it, but I find it to be one of the most profound psychoeducation methods to use for families. Because, and do you work with kids as well? Mm-hmm. Mm-hmm. Okay. I'm sure you can relate that when you're having that psychoed session with a kid, it gets lost. They're done. They're bored. They're just like, well, can I just do something else? When you have which I love that it's like 20 minutes. It was so made for kids. The Unstuck documentary, it's beautiful. And kids talking about OCD to kids. I mean, I don't know how it is more impactful than that. Because along treatment, it's funny enough, my clients will actually refer to the kids in the movie. They're like, oh, okay, well, that one boy, he was able to wear a Hulk mask, or that one girl was able to hug a tree, and oh, that one, she ripped out pages of the Bible. And they'll actually refer to that, and they see that as being incredibly empowering.
Mm-hmm.
And what that also does is it lets the parents know that here are some kids who, I mean, you hear their stories, you know that those were pretty severe cases. These are kids who came out the other side and are in recovery. And they're talking about these challenges. They're talking about how difficult it was for them. And so when parents are learning about ERP for the first time, it's very scary. And so I think it's not only powerful for the children with OCD and their siblings, but also their parents to be able to see this documentary. I can't speak highly enough about it, but that's not why we're here, Kim. We're not here to talk about this documentary.
No, but I mean, that's the beauty of the community, right? Is we all bring little pieces to what's so important. As you're talking, I'm thinking like, I need to make sure I need to make sure everybody sees that movie, because if that's the impact it's having, I mean, I've seen it and I loved it. It's when we can't miss the siblings, right? Like that's the important piece. So I love that you're talking about that. And I do think you're right. A question, totally off topic, but on topic, is when you're with a client, do you encourage them to watch Unstuck? Do you bring the family in and do this training with them? How do you apply these concepts in session? Or, for someone who doesn't have therapy, what might they do?
Ooh, okay. I'm going to answer the someone who doesn't have therapy might what they do. I'll go the therapeutic route to begin with. Of course, after you solidify the diagnosis, which again for kids can be, that can be a challenge. That can be such a challenge. So this is after diagnosis. This is just part of the therapy I do. I will say, okay, so bring in the family, and I would say I would love to have siblings here, and they'll say, well, the sibling is 5 or 6. Is that okay? Absolutely, because you will be surprised at how aware the young sibling is going to be of their older sibling. Mm-hmm. And all the time, you will also be surprised at how much accommodation the young child might be doing, because they might see that as being, well, that's just my older sibling.
Right.
My older sibling can't cut food. My older sibling doesn't walk down this one hallway. That's just how they are. Well, we also want to teach them that, this has a name, and here's some ways that you can be encouraging for your sibling. And so I have an entire session where I invite the entire family in, and we watch the movie and then we process it together.
Right.
And from there, we go on to just right away going on into the be seen model and figuring out different ways how the sibling can be involved, not othered, not excluded. And then we'll go into more of kind of like the clinical stuff, the why box, exposure hierarchy, and so forth. But you ask, how can people that don't have therapy being able to utilize this? Honestly, it's going to sound silly. I'm probably okay, there's 2 ways. I'm very competitive, but I'm not competitive when it comes to this work. I post these worksheets for free on my website, because this is something that I'm not here to make a profit off of it. I'm not even going to copyright it, because at the end of the day, if we can help one sibling feel heard, cool. That's it. That's amazing.
Right.
No amount of money or anything could ever be better than that.
We can link the links to these worksheets in the show notes. You're comfortable with that? That would be amazing.
Absolutely.
Yeah. Okay. That is so cool. And so people can kind of work through them on their own.
Mm-hmm.
Okay.
In fact, there was a family that I worked with whose younger sibling had some special needs. And what I did with the parents is I just kind of briefly explained this to them. And because they know their kid better than I know their child, and they know how their child is going to be able to kind of understand, process this, they were able to take the information they did and that they needed to be able to help out the sibling who now helps out the sibling with OCD.
Yeah. Yeah. Okay. So a couple of quick questions that I want to ask is, and this is sort of going off of some past cases that I had. So what about the sibling who's just really angry at the situation, at how the OCD has made their family very chaotic before treatment, before they were getting resources? Like, there's those children who have a lot of resistance to this idea of being a coach. How might you work with that? Is it through the empathy piece, or do you have any thoughts?
Sure. And that's a fantastic question because we can't force anybody just to do anything. And I kind of view it like the child with OCD. If the child with OCD does not want to do the treatment, well, then my job as a clinician is to meet that child where they're at.
Yeah.
And I do that very much with the sibling, the child with OCD is I'm going to have to meet that sibling where they're at. If they don't want anything to do with this, if they want nothing to do with any of this process at all, I'll do one of a couple things. One, I might refer the sibling on to a therapist who doesn't necessarily, they don't necessarily have to treat OCD, but they can understand OCD, comprehend OCD well enough to be able to have a conversation. And sometimes the sibling is like, well, I'm not the one with the problem. I don't need to go into therapy. So I'll do my best I can to coach the parents and help them to support that sibling as well.
Right. So, okay. And just conceptually, so the parent coaches are using the BC model. The children, if they're ready and willing, they're using the BC model. And the person with the disorder or the medical condition is also using the BC model for the sibling and the family, correct?
Yeah, I mean, this doesn't have to just be with OCD. In fact, as I'm looking at just the acronym of SEEN, I don't know if it just has to just reach the medical stuff, because at the end of the day, don't we genuinely want to be supportive and empathetic and encouraging and non-judgmental humans? Yeah. I think it's just kind of a neat model just to teach our children in general.
That's what I was thinking, is like, this is sort of like 101 training to be a nice person. Like,
it really is. It really is. Like I said, I'm not reinventing the wheel. I was able to use some different strategies that I've learned so originally as a therapist, I was on the way to becoming a play therapist. And and also dealing with Dr. Bruce Perry's neurosequential model of, oh my gosh, why can't I think what it is? It's his neurosequential model for trauma. That's what it is. Oh, wow. And then just pulling different play therapy techniques. And I kind of just established this, and you're right. This is basically just, I like how you said 101, be a nice person.
Yeah, but the truth is, and that's why I think it's so important, is we all are nice people. We all want to be. But when we get hit by a disorder, it's easy to go into reactivity as a parent. I know for myself, or as I've seen, siblings, it's easy to go reactive. So these are sort of basic tools to come back to the basics and recalibrate, which is why I love it. Okay. So I love this so much. Before we finish up, is there anything that we haven't touched on that you want to make sure we address here? When we're talking about supporting the siblings, but supporting the person with the disorder. Anything I've missed?
Can I list some resources?
Please.
Oh, okay. There's really not a ton of information out there about how can the sibling be involved with any medical treatment, to be honest with you. I'll focus specifically on the OCD portion. Of course, John Hirschfield's amazing book in regards to family. At the very tail end, he talks about different ways family members can be helpful. Natasha Daniels on her YouTube channel, she's so great. They're all great. Everybody I'm listing is like all stars. Yeah. She specifically has a video about how to talk about OCD with young children And I think there's actually even a more specific video about how to talk with siblings. Dr. Irene Wagner on the Peace of Mind Foundation website, there is a whole slew of stuff about how to talk with siblings. And I think the Bear family is even involved in some of those presentations as well. And then this is going to sound silly because I'm going to shout out another podcast. Is that okay? Okay. There's a couple on the OCD Stories that they talk about siblings. Jessica Serber did one about her own experience as being a sibling. And then this is an older one, maybe 2-3 years ago, Dr. Michelle Witkins. She does a lot of advocacy for siblings. And so she has an amazing podcast on there where she talks about that work.
Right. So, no, I will link to all of those. And, I'm a massive Stu fan, so don't even worry about it. No, he's been on our show. I've been on his show a bunch of times. We are very much in communication with.
I figured. I didn't think there was a feud going on.
No background feud at all. No, that's so good that you have those, and I will list those in the show notes for you all as resources to use. Thank you so much for sharing all those, and we will have links to your worksheets as well. You can list yourself in excellent resources.
Oh, you're sweet. Thank you.
Okay. Well, I am so grateful for you to come on and talk about this. I think it's really, really important that we talk about siblings, address the whole family because it is a family condition, right? Thank you. I'm so just overjoyed to have you on the show.
Well, thank you. I'm overjoyed to be here.
Where can people hear from you or get information about you?
So my website, my practice name is A Peaceful Balance, and I'm located in Wichita, Kansas. And my website is apbwichita.com. And really, to be honest with you, probably the easiest way to contact me is on Instagram. I'm probably on there way more often than I'd like to admit. And my handle is @anxiously-balanced.
Love it. And you put some amazing exposure lists and movies. It's so good.
I think I have way too much fun with those.
But no, it's such a huge resource if you're looking for specific movies, documentaries, songs. I think you do a great job of listing exposures. Thank you so much.
This week's review of the week is Run Hun. This is my number one podcast. This podcast has enhanced my life in so many ways. I have generalized anxiety disorder and OCD. Now I'm doing quote unquote hard things that I used to run away from. Just this week, I got my blunt drawn after having nightmares about it and went to a haunted house with a family. I was able to get through it and feel proud. Thank you, Kimberly. I love hearing you talk and explore all the topics people with OCD assume they suffer with alone. Today I did a hard thing and I'm so proud. Thank you so much, Run Hun, for that amazing review. And please do leave a review. It does help me in so many ways to have new listeners and for people to trust this show. So if you have a moment, please do go over and leave a review on either Apple or Spotify. I would be so grateful. Have a wonderful day, everybody. Please note that this podcast or any other resources from cbtschool.com should not replace professional mental health care. If you feel you would benefit, please reach out to a provider in your area. Have a wonderful day and thank you for supporting cbtschool.com.